I'm Beth Stroh with the TA Network for Children's Behavioral Health, and I'd like to welcome you to this month's webinar. This session is part of the System of Care Leadership Learning Community. Denise Solzbach and I co-facilitate the learning community. It's held monthly, and it's designed to support leaders in systems of care. And that could be in states, communities, tribes, territories, and it includes those both with and without federal grants. We try to address topics that are important and helpful to you, and we always welcome your suggestions for future topics, so please feel free to reach out to us with your ideas. This year we're focusing most of our sessions on operationalizing various aspects of the system of care approach, and today's session is focusing on operationalizing partnerships with juvenile justice, an area that's really important for improving services to justice-involved youth with mental health challenges. And we do like these sessions to be as interactive as possible, so we encourage you to put your questions, comments, insights in the chat box throughout the session. And we've incorporated time for questions and answers at the end. Denise and I will make sure that any questions that you enter in the chat box are addressed by the presenters. And just below the chat box, you'll see a box that will allow you to download today's PowerPoint presentation. And as a follow-up, you'll also receive a link to the recording of this webinar. I wanted to mention that at the end of the session, a link to take a very brief evaluation survey will pop up. And we'd very much appreciate your taking just a few moments before logging out to complete this and provide us with your feedback. We take it very seriously, and we use it to improve our future learning community sessions. So it would be great. Our learning management system at the TA Network that's called Ideas at the Institute. It's a platform that does allow our learning communities to be more user-friendly and interactive. And through this digital hub, you can join the learning communities that we offer. You can register for webinars, find recordings of previous webinars and resources as well. And you can interact with experts and peers. We will provide you with the link to sign up for Ideas at the Institutes, and we hope that you'll take advantage of that capability that we're offering to you now. I'm also very excited to let you know that the National Training Institutes are planned for next summer in Orlando, Florida. Many of you have attended training institutes in the past. We're delighted that this year, 2020 will be holding institutes with the theme #WhatCouldBe. And the idea is to build on existing systems with new ideas for the future. June 29th and 30th, 2020, there will be pre-institutes training programs, which essentially are two-day intensive programs in particular topic areas. And the institutes will then start with a soft opening on the afternoon of June 30th and will proceed for full days on July 1st, 2nd, and 3rd. We encourage you to budget for this and bring a delegation to the institutes, and we hope we'll see you in Orlando. Do watch for the call for proposals. That will be released very soon, and we would love to get proposals from you as well. Before we get started, I'd like to mention that there will not be a learning community session in August, and our next meeting will be in September. The topic is to be determined. Again, please let Denise and I know if you have any requests for a particular topic. As always, you can find information in the TA Telegram, and there will be a link in the chat box to the TA Telegram. We encourage you to subscribe to the Telegram if you haven't done that already. So again, today's session is focusing on partnerships with juvenile justice, and we're very fortunate to have presenters who will share examples of how they've addressed this based on groundbreaking work in one of the first systems of care in the country that has had a tremendous impact on the field of children's behavioral health, Wraparound Milwaukee. Bruce Camrat is the former director of Wraparound Milwaukee, and in his retirement, he works as a consultant with us at the TA Network and provides technical assistance to many states and communities in a variety of areas around systems of care, including working with juvenile justice. Brian McBride is the current director of Wraparound Milwaukee, and we're also delighted to have Judge Joseph Donald, who is the presiding judge of Milwaukee County's Children's Court. I would like to thank them in advance for their great work in pulling this session together for us. The objectives for today's session are really to discuss why collaboration between systems of care and juvenile justice is important, and to offer concrete strategies, practical strategies that you can use in your own environments for partnering with juvenile justice. We'll also talk about some of the challenges in this work and hear the perspectives of a judge in how these partnerships can be operationalized and used to benefit both systems of care, juvenile justice systems, and of course the justice-involved youth that we serve. So now with that, I will turn this over to Bruce, who will get us started.
Good afternoon, everyone. Hopefully everybody can hear. This is Bruce Camrat, former director of Wraparound Milwaukee, and I'm really pleased to be able to participate on this webinar this afternoon, and pleased to be back in my old stomping grounds here at Wraparound Milwaukee, and to have on one side of me Brian McBride, who I've known for a long period of time, 10 plus years, who is now the current director of Wraparound Milwaukee, and to my right, Judge Joe Donald, who was on rotation to Children's Court while I was there and is now on a second rotation as presiding judge. So we have a lot of experience at the table, and I'm going to kind of begin with a bit of a, since I do go back and was director of, when we operationalized and formed Wraparound Milwaukee in 1995, I had the good fortune to be there, so I can give you, some of the background for that and a little background on the importance of systems of care and juvenile justice and the partnerships, which are so important. I think the fact that we started Wraparound Milwaukee and that Wraparound Milwaukee has been going now for 24 years speaks to the importance of collaboration, because I don't doubt that if we did not have that with child welfare and with juvenile justice, that today these systems, Wraparound Milwaukee, would not exist today. So that power in that partnership has helped to sustain it for this long a period of time. Now, why the importance of collaboration between systems of care and juvenile justice? Well, first of all, a high percentage, we know that a high percentage of youth in juvenile justice have a serious emotional, mental health, behavioral health need that requires intervention from the mental health system. And that, I've heard various figures. Some say as high as 80% of the youth. Some say that it could be even higher. But we know a significant number of youth need behavioral health services, and a high percentage of those youth are in the juvenile justice system. Secondly, youth with serious emotional and mental health needs have higher rates of placement, are at far greater risk of placement in inpatient facilities and residential treatment centers, correctional placements. This is very costly to these systems, to juvenile justice and or child welfare. And we've learned over time that if we're not comprehensive, we take approaches that are comprehensive and collaborative, that they're usually not very effective at meeting the needs of these children and their families. Thirdly, really, we've learned no one system can typically meet the needs and provide all the funding for youth with serious emotional and mental health needs and their families. The costs usually, the resources we have to bring together are usually more than any one system alone can do that. Yet, strangely, we've had this tendency that once a youth gets into the juvenile justice system or leaves the mental health system, commits a delinquent act, ends up in juvenile justice, and the same could be said of child welfare, is that we tend then they tend to leave that system and any support from that system, and they become the responsibility, for instance, of the juvenile justice system. We call this tendency to create these very inflexible silos of funding that can't be shared across child-serving systems, and that's really not very effective in meeting the needs of these families. Going to the next slide, what are some of the benefits and challenges? And we're going to talk a little bit more, particularly Brian is going to talk about some of the ways we've addressed all of these. But if you have partnership between systems of care and juvenile justice, and you can bring that together, what are some of the benefits? Well, definitely shared accountability for these children and families. And in order to do that, though, the challenge obviously is to create and resolve the issue of who's in control. And we'll give you some tips and examples of how we've done this. Another one is sharing of information. A benefit to partnerships between child welfare and juvenile justice is then that ability to address those issues of confidentiality and information exchange. So if you can do that, that is a tremendous, the ability to talk between systems and among systems is very powerful. Conflict resolution, a benefit of these partnerships is that ability to address and resolve differences of opinion. And Brian will talk about some of the steps we've done at conflict resolution that have made that benefit been able to have been achieved. Single pool funding is another one. Another benefit, if you can partner, is blending, braiding, pooling of funding and resources across the two systems. It's a tremendous benefit to meeting the needs of children with serious emotional and mental health needs. And it's also a challenge. And again, Brian will talk a little bit, I will talk actually more about how we've done the pooling. Single care plans, the idea of having not a juvenile justice plan or a mental health plan or a child welfare plan or a special education plan, the ability to create a single care plan for youth, particularly youth in the juvenile justice system who have a serious emotional and mental health need, the ability to do this and create a single care plan across these child-serving systems can be a big benefit. And finally, the whole idea of cross-system training, and it's a great benefit in a partnership to be able to cross-train child welfare, to cross-train juvenile justice staff, to cross-train your system of care coordinators, and other behavioral health staff across these two child-serving systems. And we can always add child welfare to that. So these are some of the benefits, and we're going to talk a little bit more in depth. Now, looking at some of the potential strategies for people ask, well, how does this happen? How does a system of care and a juvenile justice system tend to come together? And I'm going to do this from the standpoint of a lot of our own experience and experiences I've seen elsewhere consulting with systems of care and juvenile justice folks in other states and communities. But it also kind of mirrors what we did and how we approached it in Milwaukee. But I think one of the first things is identifying a shared problem or need in your state or community in which stakeholders from juvenile justice, mental health, your system of care can come together. And example being too many juvenile justice youth who have serious emotional mental health needs being in residential treatment too long and not getting very good outcomes. That was a precipitating problem in Milwaukee, but you usually look for an identified problem or need that you can bring people together on to really begin to focus on that. Secondly, coming together to create a vision for how to solve that identified need. We brought together at the time, and this now goes back 20 plus years, but stakeholders from juvenile justice stakeholders at that time, also from child welfare. We also brought together family members, providers, but we brought together people to look at creating a vision for how do we solve that that need or that problem, in which in our case was too many youth in the too many juvenile justice youth, too many youth with serious emotional mental health needs being institutionalized for too long a period and not getting very good outcomes for those youth. But you need to kind of create a vision, and you need to get together to do that. Identifying the target population of youth and their families. Who are you specifically going to focus on? We chose to focus on the youth with the highest needs in the system because it made more sense than to necessarily focus on prevention and early intervention, because all of our resources and dollars were being spent on our highest needs youth. So the idea, you have to really decide who you're going to focus on and be very specific in that. Identifying the shared outcomes you wish to achieve. So if you have a vision, you have an identified population, what do you hope to achieve? And shared outcomes should be things you can measure. So for instance, some of our shared outcomes were we're going to get better, we're going to reduce the number of youth in residential care. We're going to get better clinical outcomes for those particular kids. We were going to improve school attendance. We were going to look at more child permanency. We were looking at reducing recidivism rates of juvenile justice youth. But we identified those. So as you come together, you really need to look at and identify what it is, and you need to be able to choose outcomes that you can measure. Fifth one is understanding the resource and services available and where you have gaps in services. Six is exploring, which I'm going to talk about, funding sources and how they might be blended or braided to meet the needs of that target population. And finally, creating some clear goals, objectives, and benchmarks to move your planning forward. For instance, we chose at 18 at that time, 18 months to enroll all children who were at risk of residential and who were in residential, and doing that over an 18-month period and creating benchmarks for us to see what progress we were making. But you need to have some clear goals, objectives, and benchmarks. So these are some strategies for basically where a system of care and a juvenile justice and where a partnership can begin and can unfold from following these steps. So what is Wraparound Milwaukee? It was created in Milwaukee County in 1995. We're going way back here. For children to serve Milwaukee County children who had serious emotional and mental health needs across child-serving systems, principally child welfare and the juvenile justice system. At that time, Milwaukee County, the Children's Behavioral Health was part of Health and Human Services, which included the Juvenile Justice Department in Milwaukee County and included behavioral health for both adults and children. At that time, Milwaukee County Children's Behavioral Health ran a hospital. We ran an outpatient program, some day treatment, but we really had no system of care at the time. So with our first federal grant, and we were one of the first 10 states to receive a system of care federal grant in 1994, 1995, we began to look at going through those steps that I just mentioned to create, really inform a system of care. Today, we started with 25 children, but today the system serves over 1,700 youth and young adults are served annually in Wraparound Milwaukee. And today we operate as both a care management entity, or you can also refer to it as a care management organization, a CME or CMO. And we do so as a specialized HMO, health maintenance organization, under a 1915A provision of the Social Security Act. And a 1915A, what people don't know as much about, allows you to create a voluntary managed care plan, allows you to do it in a smaller geographical area that you identify, allows you to identify the target group of youth you're going to serve, and creates a number of other incentives that are very advantageous to operate a system of care within a smaller geographical area. So we began in 1995 with this 1915A. Now you can use 1115 demonstration pride, 1115 waivers. You can do these under 1915I. There's a variety of different, we won't go into all of the different kinds of waivers that are available, but and 1915A is not the only one, but it was beneficial to us, and it has been over the 24 years of Wraparound Milwaukee. Moving on, Wraparound Milwaukee pools funding across Medicaid, child welfare, and juvenile justice, and creates a single payer system. So in this case, the system of care and the Wraparound Milwaukee as the administrator of that system of care pays for all care for children with serious emotional mental needs across child serving systems. We utilize a high-fidelity wraparound service approach with a care coordinator as facilitator. And a significant number, it's gone down actually from this slide now, so it's about 35 to 40% of enrolled youth come from the juvenile justice system and probably about 20 from the child welfare system. The rest of the enrollees in Wraparound Milwaukee, or what we call our REACH program, are not what we would be called non-custody involved youth or non-court ordered involved youth. So moving on to the next slide, the rationale for this integrated model was the need to reduce our reliance on more costly, less effective inpatient and residential care, create more accountability for placement and service options, create a means to pool funding across juvenile justice and mental health to create flexibility so that money could follow the needs of the family, and to create a single care plan with clearer roles for probation and Wraparound Milwaukee care coordinators. How we pool funding has always been something that people around the country have looked at Wraparound Milwaukee as. And I can't imagine doing this and serving children across child serving systems without using a model like this that pools funding. So if you look at Wraparound Milwaukee as the flying saucer there, the green flying saucer in the middle, which is the managed care, which is the care management entity, but also the managed care organization, basically who receives and administers dollars. I'm going to begin with the third one over Medicaid. We get a capitated rate for Medicaid, approximately $1,893 per month per enrollee, which has been actuarially determined and is continually done that, every few years. And that covers what Medicaid would say is any service that's in the state Medicaid plan, any service that's an EPSDT covered service, early periodic screening and diagnostic treatment program, and also Medicaid picks up 50% of what it deems the treatment costs of residential treatment and 50% of therapeutic foster care, which it considers to be the treatment portion. Moving back to the left then to juvenile justice, obviously for youth with these very serious emotional and mental health needs, these are very complex needs youth and their families, so $1,893 per member per month would not cover all of the costs. Not everything is covered by Medicaid. Plus, remember, Wraparound Milwaukee is assuming responsibility to pay for out-of-home care also. So we're paying for we're paying for their residential treatment care or foster care or treatment foster care, therapeutic foster care. So basically then we've evolved over time to have a rate from juvenile justice. It's currently a case rate of about $85 per day, which is really added then and comes out of their out-of-home budget, which then is added to and pooled with the Medicaid dollars. And you're decategorizing basically these dollars now, which is the power, and all of a sudden these dollars now are becoming very flexible to meet the needs of these children and families. Child welfare, we're not talking child welfare today, but that's 114, but that comes the same way. If a child is both systems, it gets split between the two systems. So the dollars flow down to a child and family, what we call the child and family team, facilitated by a care coordinator who develop a plan of care, and basically whatever services are needed are then purchased fee-for-service through a provider network, and then Wraparound Milwaukee pays basically all of the service costs. So that is basically, and we'll save time later for folks that want to talk a little bit more about how this funding model has evolved. But it's been carried us through 24 years at Wraparound Milwaukee, and has really been a solid foundation. Going to the next slide, having this type of funding is all about getting what I call win-win scenarios. So for Medicaid, it was reducing inpatient costs and emergency room visits. For child welfare, it was reducing their placement averages, their number of placements of kids in residential treatment and other types of congregate care. For juvenile justice, providing alternatives for residential and correctional placements, and for education, alternatives to day treatment costs and some of their other education costs. So the idea of pooling dollars is not, it's the right thing to do, but it also makes the most sense for other systems to bring that two together. So kind of creating these win-win scenarios. And my final slide before turning it over to Brian, eligibility for Wraparound Milwaukee are youth that meet a state eligibility definition under a DSM-5 diagnosis, that have a functional or psychiatric impairment at home, school, or in the community, a condition that's likely to persist for a year or more, involvement of 2 or more child-serving systems. They must touch any one of these 4 service systems. It doesn't necessarily need to be immediately involved in both systems, but they have touched these systems. And they have to have been at risk of placement in a residential treatment center, psychiatric hospital, or juvenile correctional facility. So my time is up. A lot of information there, and when we get to the questions, we will be able to deal with some of these in more depth. Brian, you want to take over?
Yes, good afternoon, and thank you, Bruce, for the overview. As we kind of move forward with the presentation, we are going to talk about 2 distinctive programs within our Wraparound Milwaukee and our system of care. Those youth that are enrolled in our Wraparound Milwaukee program, we call this the original WRAP program, because we have expanded to other community-based transition age and first episode type of programming. So we want to be able to focus in on our wraparound, which is our adjudicated delinquent youth with serious emotional and mental health needs that have come through the court system, and then as well as our youth that have our SED diagnosis that are currently residing in our state correctional facility, who have been determined to be eligible for reentry into their home or community placement. So those are the 2 program areas that we will speak to in regards to some of these practices that have been put into place that have built off of what Bruce has previously spoke to. So some of the things that we want to address and expand on today are innovative practices that have enhanced our partnership not only with Juvenile Justice in our delinquency management programming, but really within our court system as a whole, to be able to be flexible and nimble and be able to meet the needs of not only the juvenile justice system, but also ensuring that youth, young adults, and families are being able to access the services in the most appropriate and efficient manner to ensure that their needs are being met. So some of the things that we'll share on is a single release of information, how we go about dealing with conflict resolution, when we talk about our court and juvenile justice as well as our child welfare partners, and then get into some more of the placement and flexible court orders that are made, and how we provide those services throughout our system. Always keeping in mind that there is the overarching need of community safety and ensuring that kids who have gone through this system are not only meeting their mental health and supportive needs within the community and or in placement, but ensuring that the courts and the other juvenile justice partners are also having their court orders met or their requirements through those court orders met moving forward. So we're going to be sure to touch on some of those areas. One of the most important aspects of this relationship is our ability to have a release of information that is able to accommodate all of the needs of these programs. So what we have been able to use is one that not only includes juvenile justice, but includes child welfare, our Milwaukee Public Schools, Medicaid funding, and any other information that is needed for us to be able to create a comprehensive community plan that meets the needs of all parties included. What this does is then allow us to be able to share information to and from the court system, to and from our partners in a way that is beneficial to all. Keeping in mind that Wraparound Milwaukee, our care coordinators, and our service providers are not considered to be legal parties. We are not individuals who have a legal status within the courtroom, but we are there providing information and working alongside of these partners to be able to ensure that the best outcomes and that everybody has information and treatment in place to meet those needs. So it becomes a very useful tool for us to be able to navigate on a daily basis the information sharing that's there. Of course, keeping in mind all of the HIPAA guidelines that are in place, as well as ensuring that the parents and guardians of these youth are aware of where their information is being sent to. Our consents are actually done in a triplicate form where the family does get a copy of the consent to say this is where I have consented to my information to go, so that we all remain on the same page in regards to who's sharing what information and with whom. So so moving forward, conflict resolution protocols, I'd like to be able to say that these never have to be utilized and that nobody in our system has conflicts, but then I would not be painting an accurate portrayal of our system. But I think we've been established for, as Bruce alludes, 24, 25 years working with and understanding that our partners are at the table, to have a protocol in place that when we do have concerns, when we do have areas of need around placement, around treatment being implemented, the pace of which that treatment might be implemented, why we might not have a provider in place, or why that provider has not done what one party believes they should have done, there is a step-by-step process to be able to address that. We like to allow the boots on the ground, if you want to say worker-to-worker level, to work that out through our team process, through the ability of team meetings to then, if that can't happen, then we want to make sure that supervisors are discussing it amongst the supervisory staff, and then as you can see, it goes higher to section managers, and then finally to directors that need to be able to address that situation. All with this plan is in place, is whether it's juvenile justice or child welfare, we want to be able to go into a courtroom setting or into a judge's chambers or wherever it may be, having had these conversations prior to, we may not necessarily all agree across the table, but we want to make sure that we are presenting information in a respectful manner that has gone through this conflict resolution process if it ever arises. Flexible court orders, and I think the judge will kind of talk about this in one way or another, but our ability to be able to understand roles within our court orders and how our human service workers or our probation officers look at their need for compliance with rules of supervision that have been court ordered. While our wraparound care coordinators are really seeing it from a planning and treatment standpoint and being able to provide both that overlap within those court orders so that the teams are working together to accomplish a lot of the same goals, even if and when they're operating under their own procedures and practices, that this court order binds us together. An example is that legal change of placements need to be filed through the courts. Wraparound Milwaukee, because we are the payer of out-of-home care, or we are the payer of our out-of-home care, yes, for juvenile justice, we need to ensure that that is on the court order, that we have that flexibility to be able to work with those parties to move individuals in and out of care as seen fit with enough notice given, and that we authorize payment then for those services. So these ability to use a change of placements and flexible court orders to meet our needs is a big part of this process, that the judges, that juvenile justice and the mental health providers are all working together on the same set of standards there. Placement collaboration. Now these are things that have changed over time, but at the end of the day, wraparound probation staff and the courts all work together to provide any placement considerations that need to be met. It is one of the things that comes into play a lot is and how Wraparound Milwaukee has started was looking at kids in long-term placements and wanting to be able to provide the same level of care from the community and doing it for a cheaper overall dollar amount. We do still understand, though, today that there are times when kids will need to go in placement for a lot of different reasons, and being able to work amongst the different parties in different areas to be able to have those options, to be able to plan from a team level and to have specific roles within that placement. Wraparound Milwaukee may not be the legal placement authority that falls to juvenile justice in the courts. We still have the responsibility to provide the options to go through a referral and assessment process for different residentials, group homes, treatment foster care, informal supports. Those type of settings all fall within the realm of Wraparound Milwaukee's scope of work that we're doing within that greater system. When we look into predispositional enrollments, this is something that has been a recent addition to our way of doing business, and by recent I mean within the last handful of years. That allows youth who are coming in and who have been identified by the juvenile justice system to need services and supports, and that they want to get access to mental health services or other supportive services before their actual court order has been adjudicated. This is an opportunity now for us to be flexible and provide those services to families and to really operate under our HMO status to provide those families with those services. Now, of course, they all need to consent, and the family has the choice to say yes or no, as all of our programs are voluntary. But we have the ability to no longer wait until a kid has hit their dispositional order, that we're able to begin that process sometimes 60 days prior to their court order becoming final. It's become a way for us to be able to get a jump start, a head start, if you want to say, in regards to our planning process, in that the courts are in a lot of ways able to look at potential pre-placement, dispositional placement as saying, okay, you're established in treatment, you have these things in place, I feel much more comfortable sending you home versus a group home. There's a lot of benefits on both sides to be able to be working that early together. Same informational system. We use a homegrown IT system here called Synthesis. It is not only our data management system, it's our treatment plan, our progress notes, and is also our has our billing capabilities all built within the one system. Because we have built that system ourselves, we have shared components of Synthesis with our system parties that we're able to share information on those kids that we have in common amongst those systems. So keeping in mind that there are certain things that even through this partnership those can't have, or that we can't share information with, say, our probation officers, they are able to access plans of care, they are able to access referrals and things like that within the system that makes our relationship and our ability to be on the same page when it comes to documentation, authorizations, makes the work a little easier on the ground level to be able to share some of those components instead of having to wait for scanned faxes or not seeing it in one's own IT system moving forward. So it really has been able to expand our partnerships of sharing some level of documentation and planning with other parties. Shared provider network. Not all kids that come within the juvenile justice system are enrolled in Wraparound Milwaukee. I think that there's a smaller portion as the years go on that are overlapping. And that's not necessarily because there are more kids hitting our system. I think in general Milwaukee has been doing a much better job of being innovative and creative in regards to the services and the dispositional orders that are in place, and doing things from a front-end standpoint that have a lot of work at prevention and recidivism. But both of the networks within our juvenile justice and our mental health networks share about 85% of the same providers. Now, neither of those other systems, child welfare or juvenile justice, have the expansive network that we have of 70 different services and 120 different agencies that provide those services, from crisis work to in-home clinical services to assessments to parental supports to mentoring, those type of things. But because we have and everything operates here in the county as a fee-for-service basis, it helps with the ability to share providers as kids kind of maneuver that system moving forward. So again, all of these things come into play, and with that partnership that has been created over the years with our partners in the court in juvenile justice and probation, all with the idea that community safety is in the utmost. Our practice, and because of how the importance of how we take this work, is that every kid that comes in has a crisis plan within the first 14 days of enrollment, which ensures the courts and other parties on that end know that we have looked at services and have put things in place that will help keep the community safe, or at least there's a plan in place to keep that safe. Our first treatment plan is done within 90 days. And then lots of times if there is a review hearing, that falls in line with being able to show some progress within the court's system, that some things have been in place and that we're working towards the goals of that court order. But you know, the shared IT system, probation is able to see a lot of the stuff that we're working on, and really the overall team concept coming together. We require monthly team meetings and monthly check-ins with all providers to be able to go over the plan and really create a plan that is encompassing of all areas. One thing that is not mentioned there, we do have a court report that we do submit to the courts every time a youth that's enrolled goes into a hearing, and that is really about the treatment and the overall progress that youth is making, and through that we get good dialogue back and forth with all partners through that process. So So one second as I got my notes. So what we have come through in all this is the lessons learned overall is that there are a lot of things that we as a system can find. There's that shared value base that we're all working towards this common goal, in common outcome. We all want to see our kids be able to be successful moving forward. What has happened is that, again, we share data and information amongst our partners, that we're all working with the common language and the common differences, and we all know what those are. There can be sometimes a punitive or system-involved type of scope, but there's also a wraparound mental health and strengths-based approach, and they all come together and they work in a way that at least there is common knowledge of everybody's role and scope within that team. So you can see some of those other things that we deal with turf issues through MOUs and understanding cross-system trainings. We go through central staffing processes on the front end and back end to make sure that we are staffing kids appropriately. We go through training summits that we have wraparound trainers as well as child welfare and juvenile justice all coming together to give a collaborative training to each one of our staff, so that we're all getting the same trainings within all three systems, mental health, juvenile justice, and child welfare. So we level the playing field right off the bat with an understanding of what is happening. So as well as making sure that families' needs are met moving forward. So just some of the real key lessons learned and some of the things that to this day still drive our practice. So at this point, I'm going to, well, I might be jumping the gun here for you, but as I move to turning it over to Judge Donald, our Chief Judge, some of the things that we are going to look at is talking about collaboration, leadership, and problem solving. The benefits to a system from the court perspective, to having a more coordinated system working amongst the many different areas that we have, and then suggestions and advice from other states and communities when considering our models and approach moving forward. So I'm going to turn this over to Judge Donald at this time.
All right, good afternoon. I'm Judge Joe Donald. I'm the presiding judge at the Juvenile Court Center. And when Bruce initially talked about the beginning of wraparound, I want to say I think it started in the beginning of my judicial career. When he described, I believe on page how they pool the funds, when he described it as a UFO, or at least a spaceship, I initially thought, yes, I remember thinking that wraparound was like this UFO that just sort of hovered over the whole process. But I want to speak sort of just from the perspective of as being the judge. First of all, as a judge, I want to make sure that whatever order I put into place, that I'm putting the right kid in the right program for the right amount of time. And, in order for that to happen, I have to have a certain amount of trust in the people that are in front of me, that are providing me information. And I think trust is the biggest key to overcoming the barriers in terms of having a system of care, methodology, in terms of having it actually work. Judges, in many respects, to coin a phrase, are kind of the tail that wags the dog. I mean, they really are sort of at the end of the whole process because there's an assessment, there's a plan put together, and then somehow you have to go in and present this to the judge, who may, depending on his docket, his calendar, he may really know the case really well. He may have taken a few minutes just to review some of the filings just prior to the parties coming in, or he may not even have a clue as to which case it is. It's just, there's the time constraint of trying to get through the day. So it requires a great deal of collaboration and trust. Oftentimes as a judge, I have to, as the presiding judge, I have to have private conferences with my new colleagues in terms of educating them on wraparound, how it works, what it means, and pretty much trying to convince them to kind of stay out of the way. Just stay in your lane, you're the judge, issue the order. Don't try to get too far into the case plan in terms of the weeds, and judges can't help themselves, primarily because we are, as an entity, kind of risk averse. So, but I can tell you over time, I've learned to accept a certain amount of risk because the thing that I've realized is that brick and mortar placements, placing a kid in an institution isn't necessarily going to be beneficial to that kid or that family in the long term. And so you have to equip someone to survive within their community. And so any time that you can provide services, because services are the key in terms of increasing or improving outcomes, and it's not necessarily placement in sort of a brick and mortar place. And Brian, and you're right, there are times when we will have to place kids in an institution, but as I've learned over the years and through meeting with you and Bruce, conferencing and realizing that it isn't all about making it a long-term placement. And that's the other aspect from the judicial side is that sometimes judges will focus on things that work. So if they sent a kid to an institution and they get some sense that they feel that that's what worked for that kid, then they're going to end up sending more kids to the same institution because it just seems to work for one kid. And so it requires, at least from a judge's standpoint, to get as much information as possible, and that's, again, that's where the collaboration and trust comes in. In terms of dealing with another challenge is leadership. As a judge, we have this amazing power to convene. I often joke in terms of, I always have people, when I call them, they will return my call because, when you get a message that Judge Donald called, there's this a strong likelihood that they want to make sure that they're not the ones that are in trouble. So I often, one of the things that I've learned early in my career was that, yes, people will return my call. The other aspect, too, in terms of problem solving, and that is that you actually have to solve the problem. As the presiding judge, I get a deluge of problems that come to me every single day. I get issues with respect to what a particular court has ordered, judges that seem to go above and beyond what the issue was that is in front of them. And so again, as the presiding judge, I have an opportunity to have a beneficial private conversation. And I tell them that, look, wraparound has a proven track record. We are treating kids in the community. We've improved our outcomes, and so it works. It's just a matter of getting them to the position where they will accept that amount of risk. Now, that's not to say that there will not be that case, or there will not be a situation where there is something that goes wrong, but overall, the families, the juveniles, and the system partners feel more appreciated when they have a voice at the table, that they are given the opportunity to come up with a plan, and that the court actually allows that plan to work. It has taken me some time to really understand sort of all of the nuances of wraparound and the system of care model, mainly because I'm a judge. You know, I'm not a treatment provider. I'm not a psychologist, and I'm not a doctor, but you know, I feel and the law recognizes that I'm the one that has to make an order. So you know, I think the best thing from a judicial standpoint is to let good people do their jobs, and to spend my part pretty much staying out of the way. The problem comes, however, when, as I alluded to, there is that one case that goes wrong. Then the community, the public, wants to know